Does Medicare cover long-term care? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. In today's video, we're going to answer that question, so stick around. First of all, I want to welcome you to our channel. If you're new, don't forget to subscribe, hit the little bell so you get future notifications when we release videos, which is about twice a month. Don't forget to tell your family and friends, anybody that you know that's turning or soon to be turning Medicare age. So on to today's video. Does Medicare cover long-term care? I get this question all the time. And the next question is, if it does cover it, how does it cover it? How much does it pay for, et cetera, et cetera. But I think we have to start with, what is long-term care? What type of care is long-term care? And so there's different types of categories for care. And I think the terms that people have heard of is like home health care or nursing care or skilled care, but it's both personal care as well as it can be medical care. It can be both non-medical and medical care. And in the insurance world, we often use the term activities of daily living. It's people that need help with these activities of daily living. What are those things? They're eating, bathing, dressing, transferring, which is getting up out of a chair, getting into the tub, showering, that sort of thing, and toileting, those things. And that could be because it could be a temporary need or it could be a long-term need. And generally we define what is long-term. Usually in the insurance world, less than 100 days is short-term. Long-term is 100 days or longer. It's over 3 months. There are a lot of people that fall into that short-term need after a stroke, for example. They need a little help until they get better. Somebody had surgery, knee surgery, hip replacement surgery. They're going to go to rehab or they're going to get care until they can do it themselves. But long-term care is generally longer than that. It's more than 90 days. And it's typically those people with either chronic illnesses or they're disabled in some way. Could be permanent or partially disabled. So when we look at care, there's two ways, or there's two categories of care. There's inpatient and then there's at home. So that's what we call home health care. So let's take a look and see how Medicare covers those two types of care. Long-term care, 100 days or longer. Watch this. So we want to look at how Medicare covers the two types of long-term care and home health care services. And when you're on Medicare, you do one of two things. You either have original Medicare, which is A and B, which you get through the Social Security office, in which case then Medicare would be your primary coverage. You buy a standalone drug card to cover your outpatient prescription drugs. And most people buy a supplement in addition to this to cover where Medicare gap leaves off because there are large deductibles and co-insurance. So Medicare is your primary here, and we're going to look at how Medicare covers long-term care. The other option would be if you did a Medicare Advantage plan. Now, a Medicare Advantage plan is a Medicare approved plan that's provided by private insurance that offers you an alternative to original Medicare. However, one, you have to still be enrolled in original Medicare A and B. You cannot opt out of that, okay? And then you would enroll in a Medicare Advantage Part C, which, oh, by the way, must provide the minimum coverage that you would get under A and B, but they can also add extra benefits such as dental and vision and hearing and things like that. Most of these plans include a drug card, so you don't need standalone drug card, but they have to cover the same benefits that are covered under Medicare. They can add extra perks, but they don't add extra perks on the long-term care side. So we're going to look at original Medicare and how Medicare covers long-term care. And the best way to do that is by looking at the supplement, because the outline for the supplement, and I just pulled up Plan G, this is standardized. So Plan G is Plan G is Plan G. It doesn't matter if you're with Aetna, Blue Cross, Humana, United Healthcare, Mutual of Omaha, XYZ insurance company, whatever. These are the benefits you get. And Medicare Part A is your hospital. That's going to be inpatient. And so we want to look at what are the inpatient services for long-term care. Part B is your outpatient services. So this would include
things like home health care. So let's take a look at what Medicare pays. When you are fall under skilled nursing facility, this would be typically after a hospitalization. If you had surgery or were hospitalized for whatever reason, typically they send you to skilled nursing facility, which can be a nursing home. The nursing home has typically two sides. One is temporary and one is permanent. And so a lot of people go to a nursing home facility or what they call skilled care after a hospitalization. So Medicare is going to pay for these services. For the first 20 days, Medicare is going to pay all of the approved amounts. Now, this has to meet certain guidelines. So it's going to be after you've been in the hospital for at least 3 days, and it has to be a Medicare approved facility. And you're basically going to rehab to get better. Okay. So the 20 days is not guaranteed. It's on approval. So but generally speaking, they pay all coverages. The supplement pays nothing, you pay nothing. When you get to 21 days, Medicare is going to pay all but a copayment per day. And this does change every year. It goes up. Last year it was, this happens to be the copayment per day for 2022. It will probably go up for 2023, 24, 25. When you have a supplement such as Plan G is actually paying that, and then you pay nothing. If you only had Medicare, then you would be responsible for this $194.50 per day. But notice, after 100 days, Medicare is paying nothing. And oh, by the way, the supplement pays nothing because the supplement is designed, to pick up where Medicare leaves off. So what happens is if Medicare doesn't approve something, the supplement's not going to pay it. And when we talk about long-term care and the different types of care, it can be inpatient, it can be outpatient, it can be short-term, it can be long-term. Short-term is generally less than 100 days. Long-term care is an extended care. And so we see right here that after 100 days, Medicare pays nothing. And I use the example of my father who, after a hospitalization, he had dementia, he was falling. He went to a skilled nursing facility, which was basically a nursing home, and he was on the temporary side. And they approved so many days, and then we asked for actually more days. That was all covered. But at some point, he wasn't getting better. And basically the coverage that Medicare is going to give for these services is following a hospitalization to get better. We talk about long-term care services are for personal care and healthcare. They can be both medical and non-medical. So if somebody had a heart attack and was relearning how to walk and get out of a chair and feed themselves until they got better, generally that's going to be covered. If they continued to be disabled past 100 days and they couldn't do things on their own, like my dad, he was in the facility less than 30 days and he wasn't getting better. He got transferred to the permanent side and became self-pay. So when Medicare stops paying, you pay all the costs for that facility. Now, on the outpatient side, and we talked about the other type of long-term care could be home health care services. They do actually list home health care here. And what this says is Medicare is going to cover Medicare approved services that are medically necessary and skilled care. So what that means is that's not a home health care aide just coming in. That's a licensed clinical medical nurse or assistant or somebody that is Medicare approved, and it's necessary. Usually these types of services that are approved at 100%, Medicare pays, the supplement doesn't pay, and you don't pay, would be after a hospitalization or surgery and you go home and you need some care until you get better while you're rehabbing at home. That is typically covered. If, like in the case of my dad who had dementia, and before he went to the permanent facility, he was at home. We were bringing in care because he needed help with daily activities of living, dressing, bathing, eating, and we were trying to give my mom a break. That was not covered by Medicare. So it has to be medically approved, Medicare approved services, medically necessary, and skilled care. So when we look at one other thing I will show you here is in this guide, what does Medicare cover? They're basically covering about 100 days of skilled care, which in the definition of long-term care is really short-term care, up to 100 days. If you go to the Medicare and You guide, this is published every year by CMS, and just type in, this is a big document, I typed in the word long-term care to see what comes up. There is some reference pages here on page 55, 56 of this document. Let me scroll down here and show you real quick. Long-term care services, they're giving you some resources. So there's a couple of websites that you can go to. There's a number you can call. But generally speaking, once you get to self-pay, you can either use your assets or qualify for Medicaid, spend down your assets and qualify for Medicaid. Long-term care includes non-medical care for people who have a chronic illness or disability. This includes non-skilled care. Remember, the definition was skilled care. So a non-skilled could be just an aide or a worker coming in to help somebody with activities of daily living, including dressing, bathing, going to the bathroom, things like that. Medicare and most health insurance policies, including Medigap, which is your supplement, don't cover this type of care. So the resources that they list here are, what do you do to find care? And in the state of Illinois, sadly, 70% of the payments to Medicare, long-term care facilities, nursing home cares, comes from Medicaid, from people that are impoverished and qualified for Medicaid. So they're basing that. And why is this important? People ask me often, does Medicare cover these services? The answer is no. Generally speaking, Medicare does not cover this. And when you look at, Genworth has a website, they had sold a lot of long-term care insurance to cover these types of expenses. The statistics are pretty scary. 7 out of 10 people over the age of 65 need some sort of long-term care. And they have a footnote where these numbers are coming from. If we go down to the bottom, this is a government statistic. Comes right out of the 2021 U.S. Department of Health and Human Services. How much care will we need? So this is based on, and you can actually hyperlink to this website. The other statistics, 66% of caregivers use their own retirement and savings to pay for care. Because after 100 days, again, Medicare doesn't cover it, the supplement doesn't cover it. So you become self-pay, and that starts eating into your retirement and savings account. And 100% of families are affected by this because mom and dad or whomever, grandma, needs help. Usually it's a combination of them doing it until they can't do it any longer and having them to put in a long-term care facility. But also, if there's a healthy and a not healthy spouse, what's that doing to the retirement savings? So those of you who are on retired on Medicare primary, just know that Medicare is not going to cover those long-term care needs. You're going to get 100 days. So you might want to talk to your financial advisor or insurance agent about options to pay for that care.
So does Medicare cover long-term care? Now you know. It's very limited. Up to 100 days inpatient skilled care. It is not automatic, but they could pay up to 100 days. Home health care is going to be limited in nature. It has to be medically necessary, skilled care, and anything beyond that is on you. So there's a couple of options. You can use your assets. You can do long-term care planning, either talk to a financial advisor, talk to an insurance agent that discusses long-term care options, talk to a Medicare or Medicaid planning attorney, because some people don't have the money to buy the insurance or the assets, so they have to qualify for Medicaid. So hope you enjoyed this video. Don't forget, give us a thumbs up, tell your family and friends, and until next time, this is Kathy Bukowski, the owner of CB Health Insurance.